5 essential tips for treating pneumonia and managing symptoms. Pneumonia is a serious lung infection that can be life-threatening if not treated properly. It is caused by a number of different bacteria, viruses, and fungi, which can all cause inflammation and fluid buildup in the lungs. Symptoms of pneumonia can range from mild to severe and include coughing, difficulty breathing, chest pain, fever, and fatigue. While pneumonia can be serious, there are a number of ways to both treat and manage its symptoms. Here are 5 essential tips for treating pneumonia and managing its symptoms. With the right precautions, you can help reduce your risk of developing pneumonia and ensure that you get the medical attention you need promptly. What is pneumonia? Pneumonia is an infection of the lungs caused by various bacteria, viruses, and fungi. It can range from mild to severe and can be life-threatening if not treated correctly. The inflammation caused by these organisms can damage the air sacs in the lungs and lead to fluid buildup. This fluid buildup can cause difficulty breathing, chest pain, and other symptoms. Pneumonia can be contagious and is typically spread through contact with an infected person or respiratory droplets in the air. Risk factors of pneumonia. Certain factors can increase your risk for developing pneumonia, including having a weakened immune system, smoking, and living in a crowded environment. Additionally, those with chronic conditions such as asthma, diabetes, or heart disease are more likely to develop pneumonia. Older adults and young children are also at a higher risk. It's important to be aware of these risk factors and take steps to reduce your risk of developing pneumonia. Signs and symptoms of pneumonia. The symptoms of pneumonia can range from mild to severe and can include coughing, difficulty breathing, chest pain, fever, and fatigue. Other symptoms can include chills, loss of appetite, vomiting, and sweating. It's important to be aware of these symptoms and seek medical attention if you experience any of them. Treatment for pneumonia. Treatment for pneumonia depends on the severity of the infection and the type of organism causing it. In most cases, a course of antibiotics is prescribed. In some cases, other medications may be prescribed, such as antivirals, antifungals, or corticosteroids. Depending on the severity of the infection, hospitalization may be necessary. Tips for managing symptoms of pneumonia. There are a number of steps you can take to manage the symptoms of pneumonia. These include getting plenty of rest, drinking plenty of fluids, and avoiding activities that put strain on the lungs. Additionally, it's important to use a humidifier in your home to help keep the air moist and reduce irritation to the lungs. Over-the-counter pain medications may also be used to help reduce fever and chest pain. Preventing pneumonia. In addition to managing the symptoms of pneumonia, there are steps you can take to help prevent it. This includes avoiding contact with people who are sick and washing your hands often. Additionally, getting a yearly flu shot can help reduce your risk of developing pneumonia. When to seek medical attention. It's important to seek medical attention if you experience any of the symptoms of pneumonia. Additionally, if your symptoms do not improve or worsen after a few days, you should see a doctor. If you have a weakened immune system or are in a high-risk group, it's important to seek medical attention right away. Home remedies for pneumonia. In addition to medical treatment, there are a number of home remedies that can help manage the symptoms of pneumonia. Drinking plenty of fluids can help thin mucus and reduce chest pain. Warm compresses can also help reduce chest pain and inflammation. Additionally, getting plenty of rest and avoiding activities that put strain on the lungs can help. Medications for pneumonia. A number of medications can be used to treat pneumonia. Antibiotics are typically prescribed for bacterial pneumonia and may need to be taken for several days or weeks. In some cases, antivirals, antifungals, or corticosteroids may be prescribed. Over-the-counter pain medications may also be used to help reduce fever and chest pain. Conclusion. Pneumonia is a serious infection of the lungs that can be life-threatening if not treated properly. It is caused by a number of different bacteria, viruses, and fungi, which can all cause inflammation and fluid buildup in the lungs. There are a number of ways to both treat and manage the symptoms of pneumonia. With the right precautions, you can help reduce your risk of developing pneumonia and ensure that you get the medical attention you need promptly.